morning, everyone. We have several things to cover today, including our full vaccination schedule, as well as a small change in guidance. But first, today, March 19th, marks the one-year anniversary of Vermont's first confirmed deaths from COVID-19. Unfortunately, in the year since, we've lost 217 fellow Vermonters and over 538,000 fellow Americans. These aren't just numbers. Each represents a human being with families and friends who loved and cared about them. Every one of them, in their own way, made a mark on those around them and in their communities. While the commitment and dedication of all Vermonters has kept fatalities lower than any other state in the nation, I know how tightly knit our communities are and that a single loss can have a huge impact. Since those first two deaths, I've ordered flags to fly at half staff on the 19th of every month in honor of those we've lost. On this solemn anniversary, I've done so again, and I've also asked churches, schools, municipalities, and others to ring their bells 14 times at 7 p.m. tonight to honor those we've lost and the loved ones they've left behind in all 14 counties of our state. As we mourn, we can also be optimistic about the road ahead while doing what we can to prevent this level of loss in the future. As I've said before, just 1 year ago, no one thought we'd have these 3 highly effective vaccines to protect ourselves today. And we're making great progress. As of this morning, 30% of Vermonters, of Vermont adults, have received at least 1 dose. This includes over 80% of those over the age of 70 and those over 16 with certain high-risk conditions. That means before long, the vast majority of those most at risk of severe illness and death will be protected. And today, I'm also outlining the remaining schedule for when every Vermonter 16 and over will be able to sign up to be vaccinated. As we've discussed, we're going back to our age banding strategy, which was successful because we know age is the top risk factor and because it's the most efficient and fastest way for us to get shots in arms. So, beginning Thursday, March 25th, we'll move to all Vermonters age 60 and over. Then on Monday, March 29th, we'll go to 50 plus. 1 week later, April 5th, all those over 40 and older. And on April 12th, those 30 and over will be eligible. Finally, on April 19th, 1 month from today, anyone above the age of 16 will be able to schedule their vaccination. Now, I want to repeat this. By April 19th, every single adult Vermonter will be able to schedule their appointment. Now, to be clear, these are the dates folks will be able to sign up. It doesn't mean everyone will be fully vaccinated by then. When a new age band opens, appointments should be available within 2 to 3 weeks. And again, depending on which vaccine you receive, it takes a while before you're fully vaccinated. So, as a reminder, fully vaccinated means 2 weeks after your last dose. A good way to think about it is that everyone in each age band will have had the opportunity to be fully vaccinated about 2 months after their band opens up. So, everyone in the final age band could be finished in June, which is why I've used the 4th of July when I believe things will feel somewhat normal again. And by the way, normal to me isn't a small cookout in your backyard with a couple of friends. It's when things will feel similar to pre-pandemic. To put a finer point on it, for our high school seniors, this timeline means that in June, if we have the vaccination uptake we need and we have the supply, you should be able to have a more traditional graduation. and celebrate what you've accomplished with your friends and family. After seeing the second half of your junior year and now senior year turned upside down, you deserve it, and we're going to do everything we can to make it happen. As we vaccinate more Vermonters, we'll also be able to turn the spigot a bit more often. We've done so recently, allowing travel and gatherings for those who are vaccinated, and also allowing 2 non-vaccinated households get together. Last week, we updated restaurant guidance to allow for 6 people per table. And effective Wednesday, March 24th, bars and clubs like the VFW or American Legion or Elks will fall under the restaurant guidance. This means they can open under the restaurant guidance as long as they follow the capacity limits we have in place. Distancing is observed. Everyone is seated at tables, and all other restaurant guidance is followed. There is a caveat, however. Municipalities, by action of their governing body, will be able to take stricter action if they so choose. And as I've said, in the next 2 to 3 weeks, I'll outline our plan for emerging from the pandemic and how we'll return to normal by the 4th of July. While I'm sure this is welcome news to most, I want to remind everyone, it's more important than ever to follow the health guidance. Wear a mask, keep your distance, stay home when sick, and continue to get tested so we can stop the spread of the virus in its tracks. While we're in the last few laps of this race, we've got to remember, we're still in the race. So a lot can happen. So we've got to stay united in order to get through this with the fewest lives lost and emerge stronger than we were before. In a few minutes, Secretary Smith will go into further detail about vaccines, but first I'm going to turn it over to Deputy Secretary Heather Boucher of the Agency of Education to provide our weekly education update. Heather.
Thank you, Governor. Good morning. My remarks today will largely focus on 2 areas: an update on our COVID education recovery planning and highlighting the significant federal funding for recovery available to our education system. But first, I'll start with a quick update on surveillance testing. As of 8 a.m. this morning, 1,314 have been tested, 4 are positive. This is a positivity rate of 0.31%, and the state positivity rate is 1.3%. With respect to education recovery, recall that we are requiring school districts to assess student need and develop plans addressing that need in 3 areas: social emotional functioning, mental health and wellness, engagement and truancy, and academic achievement and success. Each of these areas is of critical importance. None is a higher priority than the others. They're all equally important to supporting our students. The breadth of these topics means that districts will need to partner with other community and regional organizations to adequately meet student needs in the weeks and months ahead. Earlier this week, districts submitted their membership rosters for recovery planning teams, and I'd like to highlight a couple of them who are adopting creative approaches. In St. Albans, Maple Run School District is including a social worker, early childhood representative, and a representative from the local Division of Child and Family Services, in addition to teachers, special education directors, school counselors, and other core district and school staff in their planning work. Franklin Northeast Supervisory Union includes representation from their regional designated agency providing mental health services, as well as their regional CTE, Career Technical Education Center, parents, and community members. Still others will be working with pediatricians, equity coordinators, data analysts, social emotional learning specialists, and private clinicians in collaborative cross-sector approaches that promise to leverage the best thinking and therefore the best immediate and long-term outcomes for our students. And we're excited about this response because we know it's going to take a community-wide approach to fully mitigate the impact of COVID on students. To turn towards how we'll pay for recovery efforts, I'll now provide some information on the significant federal dollars that both districts and the state agency will leverage to support recovery. And here I'm referring to 3 allocations of funding under the Elementary and Secondary School Emergency Relief Fund, or ESSER, which is part of the 3 consecutive federal COVID relief bills that you're likely aware of. All told, school districts will receive over $398 million in federal funds in Vermont to be spent over the next 3 years on the following: summer programming, including initiatives to address learning loss, expanded after-school and extended learning opportunities, mental health services, infrastructural changes such as ventilation, construction, and the like needed to address the pandemic and recovery efforts, technology upgrades and equipment, and any activities that would be regularly funded through title dollars, providing supports to historically marginalized students, Perkins dollars to support CTE, and other existing federal programs that support education. In addition, approximately 44 million ESSER dollars are allocated to the Agency of Education to address emergency needs as determined by the state agency resulting from COVID-19. Some guiding principles for this funding are that they're one-time funds and they should be really used in a strategic manner. The funds should certainly be focused on education recovery because that's the overall funding goal and source of the funds. And the recovery work in education is going to take some time, and that's why the funds extend out into 2023 accordingly. AOE's strategic recovery priorities for this funding include improving school facilities, including indoor air quality and other health and safety issues, supporting integrated service delivery models in all regions, and addressing learning loss through expanded capacity for remote learning. And finally, echoing what Governor Scott said, I'd like to wrap up with a message of gratitude for the hard work and collaboration educators and their partners have participated in this past year, as well as hope for what lies ahead. We're looking forward to summer in particular as a time of reconnection, replenishment, and above all, fun for students and adults alike. We've earned it. Thank you, and I will turn the podium now to Secretary Smith.
Thank you, Deputy Secretary. Good morning, everyone. Once again, we'll cover a lot of ground on the vaccine front today. As Governor Scott announced, the vaccine registration schedule has been established for all remaining age groups. We will rapidly move through these age groups, which may surprise many Vermonters. Of course, this schedule relies on a steady and increasing supply of vaccine from the federal government, but it aligns with what we have been told is our vaccine allocation from the White House. I'll start off with the details for the group opening next week. After that, I will provide an update on our vaccination program. As the governor had mentioned, starting next week, Thursday, March 25th, we will begin registration for those 60 years old and older. We ask that you create an account ahead of time by going to healthvermont.gov/myvaccine. When registration opens, all you need to do is sign into your account and make an appointment on March 25th. You can register again online at healthvermont.gov/myvaccine. This is the preferred method, or you can call 855-722-7878 if you're unable to sign up online. Please remember, and we wish to emphasize this, as the governor did, that the date registration opens for your age group is the date you are eligible to be vaccinated. It will take some time to be fully vaccinated. It will be approximately 2 months from the time you register to the time of your first and last dose appointments, and you will not be considered fully vaccinated until 2 weeks after your last dose. This is the goal is to have all Vermonters vaccinated by July 1st. In terms of our overall progress, As of this morning, 166,100 people have been vaccinated against COVID-19. 77,300 have received their first dose of vaccine. 88,800 have received their first and last dose of vaccine. Again, some of the statistics that the governor had mentioned that are really impressive. 85% of those 75 years old and older have been vaccinated. 83% of those 70 to 75-year-olds have been vaccinated, and nearly 60% of those 65 to 69 have been vaccinated. As you remember, over 90% of our deaths have occurred with those in those categories that are 65 and above in terms of age. Turning to Educator Clinics, 11,000 people have been vaccinated in those Educator Clinics, and 7,300 people have made appointments for vaccination. So 18,300 educators and eligible child care providers have received a first dose or have made an appointment for those first dose. Next week, we will have limited Johnson & Johnson allocation. This was predicted, and we have noticed that educator clinics have not been filling up. As a result, we will have fewer vaccine clinics for educators for next week only. We anticipate we will receive more doses of Johnson & Johnson in the following week, and we will ramp up vaccination for educators again the week of March 29th. If you have not done so already, I encourage all educators and eligible child care providers to make appointments. We will complete this group in the middle of April as we had originally planned. So here are the educator clinics that haven't filled. Next week's appointments are still available, and there are quite a few slots in Hyde Park, St. Albans, Grand Isle, and Hartford. I just want to mention on our community vaccination clinics, next week we'll have 91 open clinics located across the state. Next week, the clinic in St. Albans. On March 26th, we have 130 appointments that are available there as well. Corrections, just to give an update on corrections, right now 77 in-state Vermont incarcerated individuals have been vaccinated with at least one dose of vaccine. Next week, approximately 90 individuals are scheduled. 78 Vermont incarcerated individuals in Mississippi have been vaccinated, and we are working with Core Civic to make sure that all Vermont incarcerated individuals in Mississippi are vaccinated. We anticipate that any inmate who wants to be vaccinated will have at least one dose of vaccine by the end of April. All of this will mean that, what's this all mean? Well, it means that if we continue to see steady increasing supply of vaccine, we feel confident we will achieve the goal of offering vaccine to all Vermonters 16 and above by July 1st. This is incredibly exciting news, but I want to remind everyone that it may again take up to 2 months after your age group is eligible for you to be considered fully vaccinated. I want to encourage everyone to create an account ahead of time at healthvermont.gov/myvaccine, so you're ready to make an appointment when it is your turn to get vaccinated. As you can see on the chart here, we have a very accelerated vaccination schedule, so please make your appointment as soon. Please register on this site as soon as possible, and then when your age band becomes available, you can simply go onto the website and schedule an appointment. Has been an incredible year, and throughout this difficult time, I'm just proud to be a Vermonter. Vermonters all across the state can be proud of how they responded to the pandemic. Vermont has consistently been one of the safest states to live in throughout this pandemic. That is a result of Vermonters coming together and doing the right thing, masking, staying 6 feet apart, washing hands, staying home when they're sick, and avoiding crowds. I want to applaud Vermonters for where we are today, for all that you have done, because we couldn't have accomplished what we're doing now without all of Vermonters participating. And the vaccination plan that we're releasing today is a result of that effort that Vermonters have put forward. We should be back to normal by the 4th of July, as the governor had said. And I just want to say one more time, thank you. I will now turn it over to Dr. Levine for a health update.
Thank you and good morning. Our cases are still within the expected range this week, anywhere from the 50s to the 130s on a given day. There are currently 22 people in the hospital with COVID-19, 5 in the ICU. These are some of the lowest numbers we've seen in many weeks. There are no additional deaths, and the numbers and rate of deaths continue to be decreased, with March now 2/3 over. Again, clear testimony to the success of our current vaccination strategy. As many, including the governor, have noted, today marks the 1-year mark of our first deaths in Vermont due to COVID-19. I recall standing in the lobby of the health department with the governor for that somber media briefing. We all, as a state, felt those losses very deeply. Many in the state were scared and worried as the devastating impact of this virus truly sunk in and became a reality for us all. We knew this virus spread quickly and that some of our most vulnerable were at risk, but we certainly could not predict the toll that COVID-19 would take. And there we stood, maskless, in a crowded lobby, reporters in person across from us. We knew so little about this virus, had so little testing capacity, had this new evidence of how profound an impact it could have had on our entire state. Since that day in 2020, we've lost a total of 217 Vermonters. But I hope we can reflect today not on the number, but on the people whose lives ended too soon. Our hearts go out to their families and loved ones who live with this loss every day. Now I'd like to also share more about our progress in providing vaccination opportunities for Vermonters who are Black, Indigenous, and people of color. As I've mentioned before, our data shows that Vermonters who identify as BIPOC are overrepresented in COVID-19 cases and have significantly higher hospitalization and chronic disease rates relative to white, non-Hispanic people with COVID-19. We've been working with community partners in Burlington, Brattleboro, and other parts of Vermont to ensure access and provide and prioritize the equitable vaccination of BIPOC Vermonters. We've now organized the first of these specific clinics that allow a person who identifies as BIPOC and meets current state eligibility guidelines to be vaccinated with the rest of their household. So currently, that means one household member must be age 65 or older, or age 16 or older with a high-risk health condition. We now have 262 BIPOC Vermonters scheduled for a clinic in Burlington tomorrow, in partnership with the Racial Justice Alliance and the City of Burlington. Another 100 people are scheduled for a clinic in Windham County in Brattleboro next week, thanks to our partner, the NAACP. These clinics are currently full. We have already vaccinated 70 migrant farm workers in Addison County on Wednesday in partnership with the Open Door Clinic. You recall that these clinics are similar to those held for English language learners, and those connected to the refugee and immigrant communities. Those clinics have now provided 678 first doses and 339 second doses for these communities. These clinics continue weekly and vaccinate in the range of 100 people per week. Our partners there include the Association of Africans Living in Vermont and the U.S. Committee for Refugees and Immigrants of Vermont. You can find more information about these clinics on our website, healthvermont.gov/myvaccine. We continue to plan for additional clinics and will share new information as we have it. We must continue and extend the pace of vaccination. We know we have much yet to do. All of the efforts I've just described will continue in the light of the future vaccination timeline that you've seen here. A huge thank you to all of our partners in these efforts. They are so critical, so committed, so enthusiastic, and so instrumental to the success of this initiative. We still have much more to do to address historical harms and the resulting mistrust of healthcare and public health, but these are important steps forward in making sure that BIPOC communities get the support they need, in the language they need, in the locations they need to make informed choices and to get scheduled for vaccinations. Finally, I do want to acknowledge that we have gotten some good news today, learning when we will all be eligible to get the vaccine. I know for many, they have been anxious, but now excited for their turn to get vaccinated. But remember that we're still in a race against this virus, and it's changing all the while. We announced yesterday that Vermont now had 2 of what the CDC calls variants of concern. We first found the B.1.1.7 variant, which originated in the United Kingdom, and now have found it in 8 specimens. More recent lab results now show the B.1.429 strain, first identified in California. We have found the newer variant in 3 specimens. This variant is thought to be 20% more transmissible. Recall that the B.1.1.7 is considered to be 40 to 50% more transmissible. These detections were found in samples from both Chittenden and Franklin counties. We already know we are seeing an increase in COVID-19. So this is expected, but these variants are more transmissible. And that means we really need to keep up prevention until more of us can be vaccinated. Wearing a mask, staying 6 feet apart, and gathering safely are really critical right now. There has been, of late, a stalling in the dramatic decreases in new cases of COVID around the country, but especially in the Northeast. The 2 most likely reasons for this are a relaxation in following these simple precautions and the spread of the variant strains. Have COVID during time. Vaccination becoming a truly wonderful and long-awaited reality, the pandemic has yet to disappear. This is the only way for us all to stay ahead in the race. If we can use our prevention and testing tools and get vaccinated as soon as it's our turn, we can achieve a level of community immunity that will bring us all out of this pandemic. We can cross the public health finish line sooner together. Governor Scott?
Thank you, Commissioner Levine. We'll now open it up to questions.
All right, it is a little after 11:30, and we have 22 reporters in the queue. We'll start in the room with Calvin.
Thanks, Governor. So how many vaccines are you expecting to get each week that would make this accelerated timeline of vaccinating Vermonters possible?
Yeah, I don't have that right in front of me, but we expect to continue to get the allocation of the Moderna as we have a few weeks and continue to get that supply. The uptick will be in the Johnson & Johnson in particular, but they are anticipating increased supplies in the other as well. So every single week, as you know, we have this conversation with the White House, with the National Governors Association, all the governors on the call, and they give us a 3-week window. They're hoping to give us a little bit further look into the future next week into what could happen throughout April. So we're confident with what they've told us, and we believe, we'll be able to meet. We wouldn't be putting this out if we didn't think we could make it. Obviously, we've been able to accomplish everything that we've told you, I think, to date, and we have no reason to believe that we won't in the future.
Just a clarifying point, how many people are in each of these age bands?
It's on the website, and we decided not to include it in this graphic, but we do have it on the website, and we can. I think it'd be easier for you to look there, but it takes into account. You have to remember there are a number of people because of chronic conditions, National Guard, the teachers, the healthcare providers, and so forth, who have already been vaccinated within those age bands. So we've taken some steps to make sure that we're being accurate. So that's why you might see a discrepancy between the actual number, if you look at demographically, and what we feel is the number. So, but it's fairly accurate. Anything you want to add to that?
No, I've got the numbers, but you can give them off the website.
Yeah, it is on the website, the Health Department website at this point.
And then one last question, maybe this is for Secretary Smith or Deputy Secretary Boucher, but you mentioned that vaccine ups for teachers hasn't open appointments. There was that survey that went out, said over 80% of teachers wanted it. So where's the disconnect? Why are teachers not signing up?
I'll try and answer that first, and they can add their viewpoint as well. I think we're still early. We did receive some good news. I think it was close to 90% uptake in terms of those in the staff and teachers and staff within the education community, as well as childcare providers. So we need to give it a little bit more time because it's still fresh, it's still new. This is only our second week now. So we need to give them an opportunity. So I'm hopeful. We're not sounding the alarm at this point, but we are advocating for those who haven't signed up yet to do so, to look for those open appointments so that we can get the vast majority of that 90% or whatever that number was in the beginning who surveyed and said that they'd be willing to sign up to be vaccinated. So I look forward to a positive result.
Governor, given how the pandemic and the response here to vaccination and mask wearing and all of that nationally is such a political football, and people are seeing that here in Vermont. Vermonters are seeing that on the news, reading it in the newspapers, magazines, etc. I mean, you're obviously optimistic. How optimistic are you seeing our situation here, and how do you convey that to people here in Vermont that we're actually doing the right thing?
From the very beginning, I've given a great amount of credit to Vermonters for doing the right thing, complying with the guidance that we've established. And we've been a bit of an outlier when compared to other states across the country, and I believe that we may be an outlier in this regard as well. I have my concerns as we move through the age banding, as we get to the younger ages in particular, but we'll step up the PR campaign. We hope all of you will as well, because it's really important, as Dr. Levine has stated so many times, if we want to reduce the amount of spread, particularly with the variants that we're seeing, the mutation of this virus, the real answer is to get to it quick, right? Stop it now before it has an opportunity to mutate further. So that's why it's really important. This is a race to the finish. And if we can get there, if we can get as many people compliant and get their shots in arms as possible, we'll be able to stop the virus in its tracks in some respects to keep it from spreading in a different way. Dr. Levine, anything?
Couldn't agree more. You know, and the fact that Vermonters have been unique throughout this, they weren't unique. They all had some pandemic fatigue too, like the rest of the country, but probably less so. But I believe Vermonters can be unique to the very end of this race. There's no reason why we should suddenly stop being unique. We did see some interesting data today looking at the fact that the Northeast is the part of the country that's having the uptick in cases. But Vermont was unique on the map of the Northeast in having the least impact of that in terms of numbers of active new cases compared to the rest of the region. I hope we can stay that way for sure. We've recognized the power that Vermonters have with this pandemic all along, and they have the power yet to go.
Since you're there, Doctor, and looking at the time frame that we're looking at there, and comparing that with what we saw last year when when our rates started really going down, sort of corresponds with that? Does that give you some hope there?
That's a tough question because with the variant strains being sort of a wild card, and with even the rest of the country leveling off, small decreases as opposed to where they were before, it's a little hard to cycles of this virus, because you'll recall that the Northeast kind of had all of its action and then got better, while all of a sudden the South and the West were getting much, much worse, and then later than that the Midwest worse. So there seems to be some cyclical activity too, may or may not be scientifically explainable at this point, and just encouraged imagined in the last month or two, because usually we come to the podium and say, well, this is what we're getting in terms of vaccine and what we can do with it. But now, drastically and energetically, this is where we can go, and before the summer arrives, if we all continue to do all the things we're talking about and get vaccinated, we're going to really come out on top.
Thank you.
Stewart, NBC5.
Good morning. Could we talk a little bit about logistics here? It looks like you're going to be opening this thing up to, 300,000 or 400,000 Vermonters in the next month. How aren't you going to need more clinic locations, people injecting the shot? Won't your reservation system be overwhelmed, or are you adding capacity? What can we expect to see?
Yeah, we've been ramping up to this point. We actually feel as though we have the capacity based on the supply we have coming in. Now, just remember, it's all about the supply. We feel we can meet the demand and with the injections and the strategy we're using to administer this. So it's really dependent on the supply. Secretary Smith, anything you want to offer?
Stuart, the governor is absolutely right. course, I wouldn't say anything different. But the fact is, a few press conferences ago, maybe 3 or 4 press conferences ago, I talked about how we were ramping up our ability by mobilizing the National Guard in several tranches. The last one being in the first part of April in terms of the activation. The way that we're looking at bringing on other pharmacies, Costco, Walmart, those partners, the FQHCs, how we're sort of ramping up. And during that press conference, I said we're going to be ramping up to the ability to administer about 35,000 doses a week. That's in line with what you're seeing here. Is that we'll be able to administer up to 30 to 35,000 doses a week, and that is what the schedule sort of calls for. So we have the infrastructure in place. We've been building it for about 3 weeks now, and we feel confident that if we get the doses, we can get it into the arms of people. You got to remember, we're doing about 7,000 doses a day right now. So it's not a heavy lift to go to what we're talking about on this schedule.
Okay. Will the reservation system open at 8:15 on each of those dates?
Yeah, our anticipation that it will. If it's changed, I'll announce it. But we did stagger it about a week out just to make sure that the registration system, you know, we've looked at the age bands. The largest will be 16 plus, 16 to 29. That'll be the largest age band. But we have we've handled these sort of populations before, and we'll handle them here as we move forward.
All right. Finally, I did get a viewer question asking if the administration plans to bring back the travel map in the spring that will compare us to our neighboring states and give us some sense about safety. Is that coming back?
You know, we've talked about that. It won't be brought back in the traditional fashion because I'm going to be talking about what our plan is within a couple of weeks from now as to how we emerge from this. And but we've contemplated whether we should be, you know, utilizing the map to show people where we feel or, you know, what's going on in the rest of the region. So we'll take that under advisement, but we may bring it back just for to provide some insight as to where there's a prevalence of the virus and where there's not.
Or bragging rights.
Or bragging
Thank you.
rights, right.
Lisa, the Valley Reporter.
Good morning. This question's for Dr. Levine, I believe. On Wednesday, the New York Times published an article about COVID long haulers whose symptoms improved after receiving vaccines. Do you know how many Vermonters are long haulers, and would the state consider including them in the chronic conditions category for vaccines?
Yeah, very timely questions, Lisa. Thank you for those. We don't have a good handle on the percentage of I guess we're over 17,000 cases of COVID in the state that have become long haulers. All we have is the guesstimates of the research establishment nationwide, which ranges from 1 to 10%. So I have a little trouble understanding, you know, how to answer that question because we just don't have good national, international, or local data to give you a firm number. With regard to prioritizing them, that issue has actually not come up because, as you know, this news about them potentially doing better after the first dose of vaccine has just arrived on the scene. So it was never even a subject of our deliberations. We'll take it under advisement, but I have to say this is so preliminary, this information, and I don't want to do an injustice to it by calling it anecdotal, but it really is somewhat anecdotal that I'm a little reluctant to craft firm policy around it, especially when you can see the rapidity with which every Vermonter is going to be able and eligible to get vaccinated. It almost doesn't make that much of a difference, if you will, because we're talking weeks as opposed to months and months and months separation between groups.
Great, thank you very much. That's it for me.
Can you hear me?
We can.
Governor, you said a little bit earlier that normal to you won't be just a cookout in the backyard with a few friends. Curious to hear what you have thought about for guidance when everybody has been vaccinated that is willing to accept the vaccine. How long do you expect to keep masking and distancing guidance in place?
Well, what will happen from my vantage point is when we get to that 4th of July stake in the ground, so to speak, is that everything will be somewhat lifted, and it'll be purely that advisement, guidance, but it won't be mandatory. But I think we should be prepared. There are going to be a number of people who will want to continue to wear masks, and we would advocate that it might make sense to. But I would see at that point in time where the mandates will be lifted.
Okay, thank you. One other question. There's a lot of news being posted today about 3 feet being an acceptable distance. They were talking particularly for kids in school, but generally, what are your feelings about those guidelines?
You know, I watched Dr. Fauci, I think it was last weekend, and he was predicting that maybe the CDC would be making some change there in their guidance, and in schools in particular, from 6 feet to 3 feet. That would be a bit of a game changer for us, as we have talked about previously. The big stumbling block, the challenge in some respects, was vaccination of school staff, child care providers, and so forth. So we've done that. That's ongoing right now. The next hurdle that we've begun to hear is, what are we going to do about the distance? So if the CDC comes out and decides to go from 6 feet to 3 feet, that's a game changer in terms of, I see no reason why we wouldn't be back in person in remote in-person instruction before long.
Is that impacted at all by the fact that the registration for educators hasn't been filling up?
Well, again, I want to give us some time. I mean, there have been a number. What did you say 19,000?
I think it was 18,000.
18,000 thus far have received their first dose. Is that right?
Let me just get the numbers for you.
Let me get it accurately.
Yeah, it's 18,300 educators and eligible child care providers who have received their first dose or have made an appointment.
Okay, so 18,300 teachers or child care providers have had their first dose or signed up. So we're still anticipating more signing up and being able to get their first dose. So I think it's still, again, a little bit early. We've only been at this 2 weeks with the education system, so we need to give it a little bit more time, and then we'll react accordingly. But I, again, the survey had said close to, I believe it was around 90% were willing to be vaccinated. So I'm looking forward to that.
Okay, thank you.
Eric, the Times Argus.
Yes, we got a call from a salon owner wanting to know when those businesses could see their capacities increase.
Again, if you, a little bit of patience, if you wait until the first week in April, within the next 2 weeks, I'll be showing you what our plan is, and that will include some of those questions that you might be asking now, or those readers who might have questions. So we'll be opening the spigot even over the next couple of weeks, as we did today with bars and clubs. But it will make much more sense once we're able to lay that out in a transparent way, so that you can anticipate what's going to happen over the next 2 to 3 months.
Okay, thank you.
Thanks.
Wilson, the AP.
Good morning, everybody. Happy Friday. Another follow-up question about the educator clinics not filling up. Beyond just the educators the percentage of the groups that have not been getting the vaccine or the vaccinations. Have you encountered much philosophical objection to it, people who don't want it, or do you think it's just a function of not having been able to make the appointments yet, or not getting around to it?
Is this in the education system, is Wilson?
Both.
Okay, well.
Yeah, I mean both.
Again, from the education system perspective, the survey was, there wasn't much hesitancy in obtaining the vaccination, so I don't think there's going to be anything there, but I'll refer to Secretary Smith.
Wilson, to go back into sort of those mature groups that have already sort of had the opportunity to take the vaccine, long-term care facilities, we saw tremendous uptake among the residents and most of the staff in those. In the medical area, in 1A, we saw very good uptake. I think UVM had reported yesterday to me, and I don't know if it's scientific or not, but they told me that it was near 90% on the uptake on their staff. If you look at 75 and above, it's over 85%. If you look at 70 and above, it's going to be near 85%. We're at 80, we're over 80 right now. If you look at the 65 and above, that is climbing up and probably will be in the 80s as well. So if you look across the whole spectrum, we've had tremendous uptake here in terms of vaccine. We've had some pockets that we've been a little bit concerned about, and Dr. Levine and I talked with state and local officials in Essex County to get some ideas of what we can do to help out on the uptake there, and had a very successful meeting yesterday. They had some really good ideas about what to do, and we're planning to redouble our efforts up in Essex County as well. So I think I would hate to have you focus just on sort of the availability of slots in clinics, because as the governor said, it's a little bit too early to make any judgment there. It's only been 2 weeks that we've had this open, and it's like the governor said, it's 18,100 people that either have been vaccinated or will be vaccinated because they've scheduled an appointment.
Okay, the pocket in Essex County you mentioned, is that a philosophical objection, or is it a practical one of finding a place to go?
I think it's a big county in terms of land mass, obviously, and what we've got to do is when we talked to state and local officials yesterday, is the ability to, we had some clinics that weren't filling up there. And so I think it's more of the ability to communicate, and we're going to be putting up road signs. I've spoken with, this was a recommendation from one local official up there, and I've spoken with AOT on this. We're going to be putting up road signs that will tell when the clinics are and how to register, and maybe that will help as well. But those are some of the things that we're looking at.
Okay, so you haven't heard any communicated philosophical objection?
I have not heard anybody say that.
Okay, great. Thank you very much.
Mike Donahue, the Islander.
Thanks, Rebecca. Deputy Boucher, one clarification. I think you mentioned 1,300 plus tests and 4 positive cases. Just wondering where those 4 positive cases are and which schools have alerted their communities or will be alerting their communities about positive cases.
I actually don't have that data. I would have to get back to you on that. I just have the overall data this morning. Sorry.
Okay. Yeah, if you or Secretary French can have somebody send that along in case we want to try to do a follow-up question before the end of the press conference, that'd be great.
Maybe,
Governor,
Mike, sorry. Maybe Commissioner Levine can just, to your point about when the schools are notified, and tell you the contact tracing process.
Yes.
Thanks.
Yeah, whoever these 4 individuals were that test positive, obviously that's known to them, that's known to their employer and the school district. They and the health department get together and determine how much and whose responsibility it will be to do what specific contact tracing around that case, if the case was even present in school during an infectious period. So you can rest assured that it is not a community-wide announcement that needs to be made usually, because it's only one case and it may have had very minimal impact on any of the other people living in this community or active in the school.
Fully understand that, but also realize that it may have an impact on the school. So I'm just wondering how many
Yes.
are in fact, but I'll move on. Governor, Tom kind of went partway down the path about the 3 feet versus 6 feet, but I did want to follow up. Earlier this week, it was disclosed that the national average for children getting infected with COVID-19 was under 6%. The presentation showed Vermont's average was listed as 13%, I believe. Wondering why Vermont is more than twice the national average for infected children. Governor, what is Vermont not doing that the rest of the nation is doing to protect children?
I haven't seen those statistics, Mike, so I'd like to at least reserve judgment until then. I will say,
I believe they came from Dr. Levine at a presentation for human resources directors on Wednesday this week. It was forwarded to me after that.
I may refer to Dr. Levine, but I will say this, in terms of, we do have a fairly robust testing regimen here in the state. I think many other states have reduced theirs, and we have continued to have a number of people utilizing that platform, which we advocate for. But I don't know what that means in terms of the overall population. Dr. Levine?
Yes, I did present to the Human Resource Association, though we never talked about kids. But I'm thinking back on our website, and I think the number you're referring to has to do with the percentage of all Vermont COVID cases that have been in children, which may well be 13%, with the majority of those being in the 18 and 19-year-old age range, higher teens. But I'm going to have to, I'm using my memory here to think back on what those numbers look like. But that's probably the number you're referring to. And I think in Vermont, that number, if you think 13% is high, may look a little higher because of some of the nature of some of the outbreaks we've had. Earlier in the course of COVID, where there were multi-generational families impacted and children tested positive, though they weren't actually ill, but that probably increased our rate. That's all I can say right now, because I'm going to have to really look at the number you just chose and make sure we're talking about the same number.
Yeah, if you could send over your slide presentation that you gave those human resource directors that had called me about those numbers, that'd be great.
Yeah, sure.
We'll look at them ourselves. Yep. Super. Thank you very much, everybody.
And I might also add, Dr. Levine, if that includes the 18-year-olds, when you consider the number of cases we've had in some of our higher education, our universities and colleges and so forth, that could add to that number significantly.
Okay, good. Thank you.
Chris Roy, Newport Daily Express.
Yes, thanks, Rebecca. Good afternoon. Just a few moments ago, I heard from a reader who would like to know, once somebody is fully vaccinated, when he or she has to get another vaccination. They were wondering if it's 6 months or a year, or exactly when the next time is up.
Again, I'll refer to Dr. Levine, but I don't believe that's been determined as yet. They're still doing the trials, keeping track of the data, and I don't think anyone knows at this point. Anything, Dr. Levine? That's all I think Dr. Levine doesn't have anything to add. We just don't know, and I'm sure the CDC will be looking at that and providing us guidance in the future and coming up with whether it's going to be another booster shot or what it's going to mean.
Okay, great, thank you.
Greg, the county courier?
Thank you, Rebecca. Good afternoon, Governor. Just wanted to clarify on these new or at least more concerning variants detected in Franklin and Chittenden County. Can you give us a better idea of when these people would have been tested positive? Are we talking, in the last 72 hours? Are we talking 2 weeks ago, 4 weeks ago? Obviously, it takes some time to get these tests back, tested positive, and then take the DNA testing from them. Also wondering if that's attributing to some of the influx in cases, or are you seeing people, not following protocols, or is it a combination, or is it something else that may be contributing to that influx?
Dr. Levine.
They're all very important points to respond to. So first of all, anytime we get a whole genome sequencing result, it's generally a week after we sent the sample, because that's how long it takes to get this back. The B117 variant, which is the one that we've become most familiar with, is being detected on a week-by-week basis. So that's real time, that's happening. The new one, the B1429, was actually from a sample several weeks ago. However, there was no requirement to report that result to state labs at that point in time, because that variant was not considered to be a VOC, variant of concern. It was just another variant that people didn't think was very important. About 72 hours ago, the CDC determined, based on newer information, that this is 20% more transmissible, and for that and other reasons should be considered a variant of concern. So all of a sudden, we got a report saying some samples that Vermont had sent from a number of weeks ago actually showed this variant, so you've been seeing that in Vermont. So we obviously, right now, have sent samples very quickly to see if that variant is being seen consistently at greater numbers or what have you. So we'll know more about that either on next week's testing or the weeks after testing. The other thing everyone should be understanding of is that we're literally sending 20 samples a week. These are not representative of the entire state of Vermont or even a county that they may come from. These are very random in a sense because of the sampling errors, but at the same time, they are very much targeted to be the right samples to send based on the clinical and epidemiologic characteristics of the person who had the test that was positive. So we're really trying to make it a high-yield enterprise by going after those cases that we think have the highest likelihood of representing a variant. But that doesn't mean every county in Vermont has had that situation arise where it's that easy to do and it's widespread through the state. All we know right now is in these Chittenden and Franklin County instances that the variants were seen 8 times and 3 times for each of those variants. Is that clear?
Yeah, I think that's a big help. Moving on, Governor, we had a reader reach out, wanted to know if a business could hold a private event or even a public event and allow only those who could show a fully vaccinated card to enter, and if that would change any of the requirements that they're required to operate under. For instance, a restaurant breaking the 6-person per table rule, or a bar that maybe wouldn't otherwise be able to open. And I think a lot of this is coming from the perception that the rules for gathering in homes has been relaxed a lot and may even be more relaxed than if you were to go to a public establishment. I guess the question here, though, is can a private company say you can only enter with a vaccination card, and could they then change some of the rules around what they do?
You mean in a workplace? Like requiring a vaccination card to work?
In a workplace, in a restaurant, in a bar, any of that kind of thing. Can a business say you can only enter if you're vaccinated? And if so, does that change the protocols that they have to follow?
Yeah, that's one of those what ifs that I don't have the answer to. I don't know if Secretary Curley does, but something we can contemplate, but nothing that nobody's asked us this that I know of.
I can take a stab at what I think is the crux of the question. So you are correct. Currently, we permit fully vaccinated individuals to gather in a home. And our business operating guidance doesn't open that up as wide at this point. And as the governor just mentioned, it's something that we're talking about internally to try to find, the sweet spot. And so I think that you can expect to have more clarity on that in the next couple of weeks when the governor rolls out the plan. But currently, businesses don't have the ability to bypass thresholds, gathering thresholds at a restaurant or in a theater, for example, simply because people are vaccinated. But it is something that we are working on.
Would a business be allowed to bar people that aren't vaccinated? Is that allowed?
I doubt that it's well, I don't know. That would be for a lawyer. I'm not sure how to answer that.
Yeah, that was the question that I was struggling with. I don't know, and we haven't been asked that, so it's something we can contemplate. But again, some of what we're going to be laying out in before April 1 or the first week of April might clarify a few of those issues.
Thank you. Appreciate your time, Governor. Appreciate your time, Secretary Curley and Dr. Levine.
Pat, WCAX?
So, as mentioned earlier, the CDC this morning released its new guidance for schools, shortening the physical distancing guidelines to 3 feet from 6 feet. Governor, you said earlier it's a game changer. I'm curious if Dr. Levine supports the 3-foot distancing guidance in schools from a health and safety standpoint.
Commissioner Levine.
Yeah, I'm going to try to answer your question completely, but with the caveat that this information was embargoed until 15 minutes ago. So I may not have the most exhaustive review of everything that they've put out thus far. But they basically did say that a minimum of 3 feet for children in elementary school. And if you're in middle school or high school, the same would apply, but it does vary by the amount of transmission of virus that's occurring within the community. And I don't know the definitions of what low, medium, substantial, and high are. If they're similar to what CMS put out for our long-term care facilities, high would mean a percent positivity rate of 10% or greater, which we don't see in Vermont anyways, and that would mean that schools in Vermont at any level would be eligible for the 3-foot rule. They also have caveats in there about making sure that the teachers and the adults maintain a 6-foot spacing, and that in certain common areas like lobbies and auditoriums, that this 3-foot spacing does not apply, nor in the community and outside school activities that students would be engaged in their daily lives. So we have been, looking for this kind of guidance for quite some time now. You've heard all of the compelling discussions regarding how our children and adolescents are not doing so well, and the better and quicker we can get them back into their in-person learning environment, the better. So I'm pretty comfortable with it at this point in time. There were 3 publications that they put out with this press release from the Morbidity Mortality Weekly Report, which I have had the most cursory of reviews of in the limited time we've had here with this being published today. And I'm going to have to really look a lot more rigorously at them to give you a more confident answer. But I do know that if there's anything good going on in Washington now, it is the return of the CDC to its appropriate high pedestal, not being a politically directed organization, but being a science and data-driven organization. So if Dr. Walensky and the rest of the team there have put out a compelling argument and feel committed to this, I feel much more comfortable than I might have felt a year ago.
Thank you. And Deputy Secretary Boucher, do you support it? And do you think schools in the state will change their stance on returning to full in-person learning based on this new CDC guidance?
Yes, so as Dr. Levine, Commissioner Levine just said, we just got this immediately within the past 15 minutes. So what will happen now is we will get together, the Agency of Education, the Department of Health, and we will look exactly at what those guidance points are, and we will certainly be advising the field accordingly. I'm not prepared to weigh in strongly on that until we can actually take a look at what the guidance particulars are. But we certainly are supportive of students actually getting back into classrooms for exactly the reasons that I talked about this morning, actually, in terms of recovery.
Great, thank you.
Thanks.
And again, I would just add, if Dr. Fauci, Dr. Walensky, and now Dr. Levine feel, after looking at the information, that it's safe, that gives me great comfort, and it should give all Vermonters comfort as well.
Michael, VT Digger.
Hi, Governor. The House is preparing its budget proposal, and lawmakers are looking to use a lot of the new federal money the state will be receiving from the American Rescue Plan. Do you think it's prudent to spend this money in the state budget?
I think it's, I'm concerned, to be quite honest with you and blunt. I think that we're getting ahead of ourselves in some respects. We just received, the ink's hardly dry on the legislation. We haven't received any money yet. We haven't received any guidance on it yet. And we're already trying to spend it. So, or they're trying to direct it in the legislature. So I have my concerns about that. There's, at this point in time, it appears to me, we should at least figure out what the guidance is going to be. And again, the Treasury has to develop that. And we have some time. We do know that it's more flexible than the first CARES Act, where we, in the first package, we had to spend or allocate all the money by December 31st. This recovery package gives us about 3 years. So we need to invest this wisely. It can't be, from my perspective, utilizing it for programmatic needs. We should invest it in infrastructure. And we know what our needs are. For instance, broadband, wastewater, water systems, and so forth, climate change initiatives, and things that we know we had some shortcomings in the past. But with this tranche of money, it could give us the ability to build a better foundation and to fill those gaps that we've sorely needed in the past. But again, I'm a little concerned that they're moving that quickly on spending money that we don't know, again, all the details of.
Can I ask, are there any particular areas of concern based on some of the proposals that have been floated so far? Are there allocations that you specifically would object to?
Well, again, I don't know all of what they are doing at this point in time. It's happening very, very quickly, like in the last 2 days. So I just can't comment because I just know that they're spending money. All of a sudden I read in an article, didn't hear anything from the legislature, but I read in an article where they had proposed spending money in a certain area. So it's all happening in real time, and we just need to just take a deep breath. And we don't need a feeding frenzy here. What we need to do is to make sure that we're doing this in a strategic way that will help us in the future, and that we don't, that we make sure that it fills needs that we have right now. I believe, like a housing need. We know we need housing in the state. Infrastructure needs that we've had some shortcomings on. And not put us in a position where we can't afford to pay for something in the future. So that's where I've been talking about this since my budget came out. Now, again, I acknowledged during the budget address that we were using what we knew at the time, and that we knew that there might be another package coming, and we'd have to reflect on that and change. And I think the House is in the same position. House of Representatives, they have to get their budget out, I think by today. So they're ramping up to do that. And we're going to all have to acknowledge that there's going to be changes along the way. But again, there's plenty of money in the existing year, the fiscal year we're in right now, to get us through. And there's plenty of money. We have a surplus. So let's take this, let's slow down just a little bit and make sure that we're doing this in the right way. Give us the biggest bang for the buck, the best return on investment possible for the future.
Thank you, Governor.
Malia, Burlington Free Press.
Dr. Levine, I was looking over the Health Department's report from December, which broke down the impact of COVID on BIPOC Vermonters. And some of the takeaways were that the community outbreak from June largely affected Vermonters in multi-generational households as well as essential workers. And as you mentioned, cases tend to be higher among younger members of the BIPOC community. Is the state confident that it can close the gap for vaccines among the BIPOC community without opening up to specific categories like essential workers? I'm just thinking about the community members who are at risk for COVID because they're younger or working persons that aren't yet eligible or don't live with someone who's eligible.
Yeah, thanks for that question. I don't know if you're in front of a television or not, but I would just look at the screen because really that tells the whole story. We can really get through using this approach in a very rapid period of time, getting to the goal, the final goalpost of really getting all those vaccinated who want to be vaccinated in the state of Vermont as quickly and expeditiously as possible. So even if you're 25 years old, you're eligible to go on and set up your appointment 1 month from today. That's pretty rapid, the way things are going. And then within 2 months of that, you will be fully vaccinated. So I think that's the major message I'd like to convey today, and that we will be able to continue to achieve our goals with the BIPOC population by continuing to be consistent with this process. Doesn't mean we are going to stop anything we're currently doing. So all of the efforts that are going to that population with regard to education, registration, aid with registration, appropriate access to the vaccine, special clinics that make it more accessible, focusing on the multi-generational, which, by the way, I'm hearing from around the country that no one has focused on nationwide. We are focusing on it because it's a data-driven approach based on the data in Vermont. None of that is going away while we continue to do this approach. If I may, if I may take advantage of your calling me to the podium, I did find on our most recent weekly update, since kids have come up as a big part of the conversation today, At this point in time, children represent 20% of Vermont cases. And if we look, and a child means under age 20. 26% of these children are in the 18 to 19-year-old age group. So just to provide some grounding on the numbers that are being thrown around. Thank you.
Great, thank you.
I wanted to go back to the previous question about the budgetary concerns and the use of the recovery money, and ask Secretary Young if there was anything that I missed that you wanted to include. Secretary Young has been closer to this issue than I have over the last couple of days.
Thank you, Governor. Yes, there is to the question quite a bit of allocating going on as we speak since about Tuesday in two separate vehicles, H315, which was on the Senate floor for second reading this morning, as well as under consideration, as you noted, in the ongoing budget work that's being done in House appropriations for the 2022 budget. The understanding is there's about $1 billion. I know I keep missing that B. $1 billion of more flexible money in the state fiscal recovery section of the American Rescue Plan that will go to the state for various projects, and some really exciting opportunities there, as you noted, for water or broadband infrastructure that we all know is costly. So it is something we're watching, but I think the goal is for House appropriations to spend about half of the money in the budget, and then once they get the budget done, to spend the other half in another spending bill. So, it is concerning that it's moving so quickly. There's not a lot of input into the decisions that are being made. We hope that, there will be a slowdown after the big bill is passed out of House, where people are being more thoughtful about where the money is going, and perhaps involving, more public input and administration input at this point.
As a reminder as well, we have a number of businesses that are in dire straits, particularly in the hospitality sector, that could use our help right now. And that's what we should be focusing on, because we need to make sure they recover and survive over the next 2 or 3 months, so that we can put people back to work. We still have, over 30,000 people on UI and PUA, and we want them to get back to work. So we need the businesses there in order for that to happen. So it's all interconnected, but we need to prioritize and make sure that we're taking care of the emergency first.
All right, we'll go to Liam, VPR.
Hi, Governor, I was just wondering when you might be easing more restrictions around long-term care facilities in the state. I know that Dale had issued some updated guidance this week that I believe went into effect today around some visitation restrictions getting relaxed, but do you have a timeline for when things might be returning to more of a normal for these homes?
Yeah, Secretary Smith, could you comment on that?
Thanks, Liam, for the question. As you pointed out, we are updating our guidelines based upon CMS guidelines. As you know, the skilled nursing facilities are completely guided by CMS guidelines, and we try to dovetail for the others what those guidelines are. The CMS guidelines are opening up visitation, and in particular talking about physical contact, and how you do that. We'll continue to update as CMS updates, but I think, our schedule is dictated a little bit by CMS on the skilled nursing facilities, but we mentioned about 3 weeks ago how much we were opening up. We're opening up even more now, and also allowing things that we just haven't allowed in about a year, to happen. Now, there are protocols that are still in place to make sure that our long-term care facilities are safe, but at the same time, I think you'll see, based upon what we have talked about with with the long-term care facilities over this week and the guidelines we're issuing now, really start to open up those facilities in a much greater way than they have. I will say in the next few weeks, I'll probably have an announcement on adult day and other areas that will be opening up in the very near future, as well as vaccination starts taking hold here in this state, and it has quite significantly taken hold in the 65 plus range. And if you look at sort of, we get slides every morning, and if you look at where deaths have and COVID cases have really fallen off, it is 70 and plus. I mean, it is unbelievable in terms of the reduction in cases in that area. So I think you're going to, Dale has opened it up even more based on CMS guidelines. I think you'll see us opening up other parts of those seniors, where, the day-to-day life of those seniors in other instances as well.
Okay. And a broader question on reopening. One of the things we don't have a great sense of right now is how long the sort of immune response from the COVID-19 vaccination lasts. And so I'm wondering, as we look at July as potentially a time when things return more to normal, how confident are you that we'll be able to do that? I mean, at that point, people that got the vaccine first in December and January will have been vaccinated almost 6 months, and if their immunity doesn't last that long, couldn't we be in a position of just seeing more outbreaks down the road?
I'm going to ask Dr. Levine to answer part of this, but I just want to remind everyone, we are not going to get rid of this virus, regardless of how well we do with the vaccination process and how well we do in other regards. It's going to be with us for quite some time, but what we're trying to do is reduce the number of deaths, the hospitalizations, so it doesn't impact our way of life. But it will be here, and it could continue to provide for positive cases over the next year, 2 years. It's just going to be another strain of a virus. But I'm confident in that we'll be able to return to normal after the 4th of July. But I don't know how long the vaccine will last. Dr. Levine.
So we're talking about two kinds of immunity. One is really natural immunity, meaning you've had the infection and then develop antibody responses. And the other type is vaccine-mediated immunity because you got the vaccine. We saw some very encouraging data recently that's looking at people who actually had COVID and looking at how long their antibodies seem to be present. And numbers like 6 to 8 months are now being thrown out as preliminary analysis of that data. We also now have vaccines that, even though I agree many people in the older set and in the healthcare workforce got their dose in January, people who got their doses as part of the studies got them much earlier in 2020. So those are the kinds of data points we're really going to be looking at to understand the duration of vaccine-mediated immunity. I don't think you're going to see a widespread campaign in the summertime to get people revaccinated who just got vaccinated earlier in the year. I think it's more likely, if you see anything, it will be discussions about tweaking the vaccine itself, especially the mRNA vaccine, which is a lot easier to do this, as I'm calling it, tweaking with, so that the right immunity is given to the person. So if there's variant strains that have taken over and we're concerned about the fact that current vaccines may not adequately cover them or just cover them in a way that protects you, but you could use more protection. Discussions and manufacture of those kinds of enhanced vaccines will come out. So it won't be a matter of giving you a booster to your immunity. It'll be a matter of giving you a newer type of immunity towards what's circulating out there now. And keep in mind, in July, it is going to be summertime. People will be outdoors a lot more. And we don't see a lot of viral transmission in the outdoor settings generally. That's been one of the nicer features, if I could use the word, of the virus. And we've really gotten comfortable from a lot of literature and from perhaps protest experiences in this country where we did not see a lot of virus transmission occurring outdoors. So that's all I can say for now.
Thank you.
All right, just a quick update. We're about an hour into questions at 12:37 and only 2/3 of the way through the queue. Aaron, VT Digger.
Question of herd immunity. One thing I'm also hearing as a potential note of concern is that people under 16 obviously still aren't able to get the vaccine. And I've even seen some analysis that indicates that the U.S. probably won't reach herd immunity until it's able to vaccinate the younger population. I guess I'm just kind of curious how that will play into like the guidance and the ability of people to do things during this return to normalcy.
Michelle Levine.
I'd like to say it should have no impact at all, because if we're doing all the things that we're supposed to be doing, and as the governor's indicated, these aren't getting thrown away, these masks, because we got a vaccine in our arm. They're all going to continue on through the spring and certainly up until July 4th, and then we'll have more news about how that may or may not impact our lives as the rest of 2021 evolves. But that's part of the reasons why everyone is going to be continuing to do those behaviors, even though life will be markedly different and I hope for all improved. Keep in mind that several of the vaccine manufacturers who have already had their vaccines receive EUA, or in other parts of the world receive approval, are already progressing on with trials in those under age 16. So we'll have more information on that in a timely way, we hope, as well. But I don't want people to, again, focus inordinately on herd immunity or community immunity, whatever you choose to call it. We don't know the precise number with this virus at this time. Low ball estimates are in the 60% range, high ball in the 85% range. So the truth is probably somewhere in between, based on experience with other viruses of this sort. And you've seen the incredible uptake statistics that Secretary Smith talked about in our 65 and older, 70 and older age ranges, and in our healthcare workforce. So we'll have to see how that goes, but that may actually turn out to be much more promising than you might have imagined as well. So we shouldn't fixate on the number at this point in time. We should really fixate on what's going to happen in terms of our daily lives, our daily behaviors, our mitigation strategies, etc.
And just to clarify, I mean, there's a possibility of vaccines having an effect on COVID cases before herd immunity, right? I mean, since if 50% of the population can't get the virus, it does provide some level of protection.
Yeah, I mean, every time a person gets vaccinated, that brings us even that much closer to much more overall health in our state, and much more, I equate that with economic and other recovery in our state as well. It all fits together. But you're right, even if the population at large hasn't reached 60 or 80% yet, because they haven't all been able to get their vaccine yet, the people who have got the vaccine protected against the most serious. They may get a mild. Been vaccinated, they shouldn't get anything on the more severe end of the spectrum. And keep in mind again that we are in Vermont very blessed by having had such a low disease rate from COVID compared to really the whole country. But that means we do have less natural immunity. So we are all going to have to be reliant on the vaccine immunity by and large to protect us.
The inmates that have gotten vaccines so far, there hasn't been a change to the eligibility rules for inmates, correct? And you are not considering, vaccinating inmates earlier than the general population?
Yeah, there has not been a change, and they will be vaccinated like everyone else with the age banding.
Okay, thank you.
Joe, the Barton Chronicle. Joe? All right, we'll go to Avery, WCAX.
Hello. Is the state confident they're able to reach all BIPOC Vermonters through these organizations that they're using for outreach, or might there be some that may not be connected to these organizations that could be falling through the cracks?
I think the reality is that we are concerned that there will be some falling through the cracks, and we're going to do everything we can to make sure that they get the information they need and to make the right decisions, but it is a concern of ours. Dr. Levine, anything?
Yeah, I would echo the concern, but we stand a far better chance of at least doing it with the approach we're doing, so that we try to connect with as many as possible, and hope that just like any Vermonter, anyone else that we may not have been able to directly, individually connect with will understand that they have a chance to be vaccinated very expeditiously here in Vermont.
Okay. My other question is about medical waste. Is the state seeing more medical waste with more vaccines, testing, masks, all of it, and how are they handling that?
I have absolutely no knowledge on that, except to say that using common sense, there has to be more. This is a vaccination effort nationwide, never mind statewide, that is unparalleled in history. So the numbers of gloves, the numbers of syringes, the numbers of needles, the numbers of vials of magical liquid have got to be incredible. I would bet some of the people in operations and in facilities management at our major hospitals would have some much more direct insight into that in terms of even pounds and tonnage of waste compared to previous. But it has to be more, there's no question. And then if you just think about our testing enterprise, forget about vaccination. That requires a tremendous amount of PPE, testing materials in terms of collections, reagent materials in terms of the laboratory, et cetera, at volumes that are just unparalleled with anything seen in the past. So you probably opened up a little bit of a door to a door that we may not have wanted to look behind in terms of how our whole environment and society is dealing with that. But I do know that, this is still what you would call medical waste, and there are very strict protocols that are adhered to with all of that. So I'm sure they're just being challenged by volume, not by having to change anything that's been done.
Thank you.
Tim, Vermont Business Magazine.
Hi, Governor. I had another question about another bill going through S10, which you're probably familiar with. It increases unemployment insurance benefits. And the concern from the business community seems to be, well, twofold. One, it would take some money, I suppose, from the rescue money, up maybe $50 million or so. But the bigger concern is that it'll disincentivize people going back to work. and especially in those jobs you've discussed in hospitality, et cetera. Are you concerned at all that the unemployment, the extension of the unemployment on the federal side, and perhaps even this bill could actually keep people home instead of getting them back to work when we have, a labor shortage already?
Well, again, there's obviously some concern amongst the business community about this. They've spoken loud and clear about what they think should and shouldn't happen, and enough so that I believe that it put a pause on the legislation moving forward, and I don't know where it's at right now. But, seeing the chart we have here, everyone who wants to be vaccinated, 16 and over, will be able to get signed up by 1 month from today, April 19th. And we're well on our way, I believe, to recovery. So, as I've said, having the opportunity to go back to work and do things in a normal way just opens up all kinds of opportunity for us, more mobility, more of a sense of normalcy, and in all fashions. So I'm hopeful that there won't be a need for additional UI in terms of trying to keep people afloat in a lot of respects, especially with the $300 that's being added to the weekly benefit today, and that goes on for quite some time. So if I thought there was a need right now and we didn't have the $300 in place from the federal government, I might feel differently. But I think the additional $300 at this point in time is getting people through. But what we really need to do is get them back to work.
Well, I mean, that's a big part of it, is even the federal extension could disincentivize people from, going back to work, because maybe they would even be making more money or similar money on unemployment benefits, which are, the federal program is going through September. So, and the bigger question is there a concern there that we can't bring people back to work?
Well, again, I believe that getting people vaccinated, getting people more comfortable with getting back to work in the normal sense is the key. That's the answer, and I believe we'll have that available to us by 4th of July.
And as a follow-up to that, it looks like the Unemployment Trust Fund, the state Unemployment Trust Fund, has enough money for about 70 weeks. So I assume you're probably not concerned about that.
I'm not. I watch that on a weekly basis from the very beginning, and it looks like we're out of the woods in that respect. I think California had to take out a loan within 2 months of the pandemic because they were underwater. But we had built up enough capacity. We had over $500 million to begin with, and we're down around $200 million at this point. So we've made it this far over a year now with what we have, and things are only going to get better, I believe. So we should be well out of the woods in terms of making sure that we have enough in the trust fund to get us through the following year and the seasonal approach that we've seen in the past. So I'm quite comfortable with that.
All right, great. Thanks, Governor.
Guy Page, Chronicle of the Vermont State House.
Governor, an estimated third or so of Americans have either health, philosophical, or religious objections to being vaccinated for COVID-19. If next month they may be prohibited from eating, shopping, or going to work, how will you respond to their claims that they're being treated unequally like second-class citizens?
Well, I haven't put forth anything that would preclude them from doing anything that you mentioned, so I'm not concerned about that. Again, there may be guidance in place if you haven't been able to get vaccinated or refuse to be vaccinated. I know in the healthcare, for instance, in healthcare, there is a provision in some institutions where if you have in the past not wanted to, for whatever reason, not wanted to get your vaccine for flu, for seasonal flu, that you have to wear PPE, you have to wear a mask. And that's been in place for a number of years in certain institutions. So if we may get to a point where it's advisable for you to continue to wear a mask in some of those settings, but we haven't contemplating refusing anyone when we're out of this pandemic. In fact, you know, I want to get to a point where we don't have to have the state of emergency at all.
Okay. So this wouldn't be so much denying service as you need to wear a mask and social distance and that sort of thing.
I'm not contemplating that whatsoever. When we get through this, I believe that we'll continue to provide guidance and advice on what you should and shouldn't do, and then it's going to be up to you.
Okay, thank you. Also, H-167, the Environmental Stewardship Board bill, would give some oversight over the Fish and Wildlife Board, you know, the Hunting and Fishing Board. Your thoughts on the necessity and wisdom of adding another board, the Environmental Stewardship Board?
Yeah, I am not familiar with that at all, Guy. I think what we have in place, we have trouble filling all the boards we have now. I can't imagine adding another one to that, but we'll see. I haven't seen that. Did they get through crossover?
No.
Okay, so we don't have to worry we don't have to worry about this year then, right?
Well, this is legislature we're talking about. I'm not sure, but I see your point.
Yeah.
Thank you.
Colin, 7 days.
Yeah, hi. I have a couple questions about the recent moves to relax some of our restrictions. Specifically, I'm thinking of the unvaccinated household gatherings and then the upcoming reopening of bars. Given our stubbornly high case counts and the emergence of these more contagious variants, can you talk a little bit about the justification for making these moves now instead of waiting until more people are vaccinated, knowing that the behavior will inevitably lead to some more transmission?
Well, again, every decision we make, we work as a team, and we rely on the advice of our health experts, and we came to the conclusion that this is the right point in time to do this and open it up in a safe manner. But we, again, as I said, when you look at 1 month from today, we're opening up the last age band, and at that point, all Vermonters 16 and over will have been given the opportunity to be vaccinated. So I think we're well on our way, and I think we have shown that we've taken a cautious approach. It's worked for us, and we should be able to benefit from it now. Now, we're not like other states like Texas and others who have just opened up their economy and done away with all the mask mandates and so forth. We feel we need to continue to have the mask mandate until we're through the vaccination process. But I think it keeps us all safe, and we feel optimistic about and confident in some of the decisions we've made.
Could you just, so I hear you when you say you've been having conversations about this with your health team. What is your health team saying that tells you that it's time to make these moves?
Well,
what is the data, the science?
We wouldn't do this unless they said they were okay with it. You know, we present this, we talk as a team, and they have the opportunity to say we shouldn't be moving forward on this because we have grave concerns. And when that happens, we don't move forward.
Is there an inherent acceptance here that we can deal with a continued 100-day average case count to, for example, jumpstart some of the economy or help deal with some of the isolation that people are feeling? I mean, obviously this is a balancing act and there's a lot of competing interests, but I think some people are just curious as to why, given the case counts are still so high, that we would make some of these moves now.
Again, we feel as though our case counts have leveled out and that we're in good shape.
Thanks.
Yes, thank you very much. I'm curious about the Newport prison outbreak. Facility has been in full lockdown for a little over 3 weeks now, but tests are still coming back positive. I'm wondering if you're learning anything about the mechanism of spread, as to why it's still circulating despite the lockdown, why it's crossing between units. And is it possible that some of the most recent cases were the time of infection occurred after the facility was put into lockdown?
I'm going to refer to Secretary Smith. I think we have some theories, but nothing substantiated.
Thanks, Andrew. What is recommended when we have a situation like this is that you cohort, and that means you sort of those that are exposed and those that have the disease, have the virus. We cohort to sort of through contact tracing to make sure that we seal off sort of any spread among others that aren't associated with those two sort of populations. And up in Newport, that has been successful, frankly. The units where we're seeing the positive come out are those isolation units where we're seeing positive. So I think what we're seeing is exactly what we thought we would. We were hoping that it would be sort of less than what it is. In terms of theory, I think there are two major theories, and they're theories. One is that it did come from the outside through correctional officers and that were coming into on various shifts. And the other theory is that it's being passed inmate to inmate, mouth to mouth through diverted narcotics and diverted drugs, medicated drugs that they have. Those are the two working theories. Could be one or the other, or it could be both.
Can you explain your second theory a little further? I guess that's not clear.
Yeah, there are some inmates that get what are called MAT, which is for addiction purposes, get various drugs in terms of helping them get through the various to wean off addiction. Some of those drugs sometimes are diverted, and they're not swallowed. They're kept in the mouth, and then they're sold. And that could be one theory.
I understand. Staying on topic, I see according to the DOC dashboard, there's one in-state inmate that's hospitalized. Is that connected to the Newport outbreak?
It is, and that individual has no fever. O2 saturation levels seem to be fine, but out of an abundance of precaution, that person was moved to Newport Hospital.
And heading south now to the St. Johnsbury prison, they've been on lockdown and have positive cases among the staff. With at least one case coming back this week. What's the status on that facility?
Yeah, they have 4 staff people that are positive. I think one came back yesterday, but don't quote me on that. But they have 4 right now. Just to give you a sense of how many staff system-wide, and remember, we have over 600 staff. We have 11 staff members that are positive today. We have 41 inmates system-wide, 40 in Northern, which is the Newport prison, and 1 in Southern that's been quarantined. That person was quarantined, came into our system, was quarantined, and was tested positive, so remains in quarantine as we move forward. But that's what we have system-wide. And when we have positives in a facility, we lock down the facility. Sometimes we do a full lockdown. Sometimes we do a modified lockdown. And what we do after that is test, and we'll test multiple times a week to make sure that it isn't spreading, and the fact that we've got this under control, and then the lockdowns are lifted from there.
So is there testing planned for the St. Johnsbury facility in light of this, this week's stat case? Or has that already been done?
Yeah, absolutely. Obviously, this was picked up on the testing. I believe it was picked up on the testing, but it's standard protocol, Andrew, that as soon as we have a positive in a facility, we start the immediate protocol for testing, which is pretty aggressive testing over a certain amount of time.
Okay. And while you're at the podium, Secretary Smith, can you just describe a little more your meeting with the Essex County officials? Was that spurred on just by the low uptake out there? And who did you have on the call with you? Sort of what were some of the theories on why it's low uptake?
You know, I think I had addressed this earlier, but it's a big county, and it's a long county, north to south, and I think, and it's a rural county. I think there's just 6,000 population there, so people are pretty spread out. So we have vaccine clinics in Beecher Falls, Brighton, and Concord. To the west, we have, a lot of capacity in terms of Newport and Derby Line and the pharmacies on the west. On the south, we have St. Johnsbury and pharmacy capability there. But it is a drive. I mean, it's 30 to 45 minutes to get to people, and some people just feel that the communications aspect of where these are and how we sort of communicate and get get people cognizant of what is going on. I want to say this: it doesn't take that many more people to bring it up to the statewide average. It's a small. The population is fairly small in that county, so it doesn't take a lot of people to bring it up. So what I'm thinking, what we think, and this came right from a local official. We're going to put road signs up there, those AOT road signs that flash, that have various information on where and how you can get a vaccine. I think one of the thoughts was, make sure that it says free vaccine and where to go, which would be the health department website. So those are some of the things we talked about.
And so that would suggest that you're thinking or hoping that it's perhaps just a messaging issue. People aren't aware that the clinics are there and they should be signing up at this point?
I think also, and Dr. Levine brought this up yesterday, is we've got to reach out to the healthcare providers on the New Hampshire side as well and make sure that they understand where the clinics are, because a lot of people get their healthcare in New Hampshire, and make sure, especially in the Canaan, Beecher Falls area, make sure that they understand when and where the clinics are for those. So, yeah, I think it's making people aware, making healthcare providers aware. I went through the list of how many vacancies we had within the testing facilities in terms of unused slots, and we have slots up there. We just need to bring people to those slots, and we need also to make sure that people understand, and the healthcare providers on both sides of the river understand the schedule.
Okay, thank you.
I want to go back. I know we're running late, but I want to go back to Colin from 7 Days and his question about why I feel, or why we feel confident in moving forward and opening up the spigot a bit more. And I missed repeating what we say a lot in these media briefings about our goal. Our goal from the very beginning was to preserve life and keep people out of the hospital. So when you look back, we know, especially today, when we reflect on the 217 people we've lost, the Vermonters we've lost, 90% of them were over 65. And those with chronic conditions as well have been the ones who have been hospitalized. So we just developed a strategy, our age banding strategy, to take care of those who are impacted from loss of life and hospitalization. We're just getting through that. I mean, we're at the tail end of, and you heard Secretary Smith talk about the high the high percentage of those who have been vaccinated. So, and you can see from Commissioner Piechek's modeling showing, you know, the number of deaths has decreased, the hospitalizations have decreased, and we're just going to have to get a little bit more accustomed to there's going to be some positive cases. It's a fact of life, but we're not going to see the hospitalizations we've seen in the past, and we're not going to see the deaths we've seen in the past with the vaccine that has been implemented, the strategy that we've utilized. So that's the very foundation of everything that we're doing. And now that we're opening up to the next age brackets, all Vermonters will have the opportunity by April 19th to sign up to be vaccinated if they choose to be. So 16 and over. So again, that gives us confidence in moving forward, opening up the economy, and the spigot turns a little bit more regularly, and we'll get back to normal by the 4th of July. With that, no other questions? We'll see you all again on Tuesday. Thank you very much.